Hello, Wade Brennan here, Principal Physio at Central Physio and Health. As promised in our last pain education video, this video is to walk you through step by step what to expect for your physiotherapy assessment and treatment. Firstly, we want to point out that we are different to other clinics. We wanted to take you through the three different areas and show you how we're different. So the first area we'll walk you through is traditional physiotherapy, what physio school taught us. The second area is whole body movement assessments, things we've learned since finishing physio school. And the third area will be whole body functional strength training, something that physio school doesn't teach us at all. So this video aims to walk you through all three areas and really highlight what's involved in each area and what are the benefits to you in overcoming pain and injury. So why traditional physiotherapy? This is what physiotherapy school taught us as physios. So this is how we were trained at physio school. It's often a very narrow view look at your problem area. So for example, if you have lower back pain, physio school taught us to look at your lower back and not much further than that. It can give your injury a label. So for example, you can leave the session knowing that you have an L5 joint sprain in your lower back, or you could leave the session knowing that you have a grade 2 ligament sprain in your ankle. We understand that this is very important to clients, so clients are often looking for a very clear structural diagnosis, as I've listed above, or a label. So clients want to know what is the sore spot, where is the pain coming from. So we still use traditional physiotherapy assessments in order to give our clients a structural diagnosis. However, the issue lies here. This narrow view often, not always, but often does not help us know what to treat to fix you. So in summary, we now have a name for your problem. It's got a label. We know what structure is sore, but we don't really know what to treat. Moving on to the whole body assessment. So why do we use whole body assessments? We use them as they really help us find what to treat to fix you. So we have a label from traditional physio, but now we find what we need to do to fix you. We look top to bottom through your whole body. We're looking for two things. What is stiff or tight, which we call a mobility issue, and what is weak or unstable, which we'll call a stability issue. What's stiff? What's not strong? Anywhere in the body. So why are we doing this? So we're really looking for what else is potentially causing the excessive strain on your painful or your sore part. It's important to remember, guys, that the painful part is often working absolutely fine. We see this all the time, but it has so much extra strain on it from other areas that are not moving well. I'll give you an example. We see this day after day with people coming in for lower back pain. Most lower back problems are really a hip and upper back issue that's not corrected yet. So what does this mean? It means through the hip area, it's stiff and weak, which puts more stress on your back. And through the upper back area and shoulder area, it's also stiff and weak, which puts more pressure on the lower back. So the lower back's got pressure coming up from the hips, down from the back, all this pressure on the lower back, and then all of a sudden, lower back pain. It's not the lower back's fault in that example. This can be exactly the same story for your ankle pain, your knee pain, your shoulder pain, your neck pain, or your headaches. We find this really commonly that the sore area is actually doing quite a good job, but other areas anywhere in the body that mechanically put pressure on that area are not doing such a great job. So in summary, why do we use whole body assessments? We use them to find what to treat. Now the third key area, why do we use whole body functional strength training in our physiotherapy assessment and treatment? This is what maintains the improvements long term. So we gave your pain a label, we found out what to treat, we treated those key areas. This program is what maintains those improvements long term. What we found in your whole body assessment gets put into your program to do at home or the gym, whichever you prefer. So for example, if we found stiff hips in the assessment, then hip mobility drills go in your program. If we found a weak left shoulder, then left shoulder strengthening exercises go in your program. So your program is to maintain the changes that we did correct through your physio. What's also important is many people do things at the gym that contribute to the problems we found in the whole body assessment. So if we go through your program, and find some things that you're doing that are actually causing the problems we found in the assessment, we need to do some adjustment. So if we don't adjust the program, the problems will simply come back again and again, and we see this often. Lastly, many people simply aren't strengthening enough movements in the gym, so they're missing key areas to stay moving well. If we go through your program and you're strengthening chest on one day, arms on another day, that's your 2 sessions, there's many key areas that are getting missed. So we need to adjust the program in that respect so that it covers all body areas and all movements. Lastly, we are experts in functional strength and conditioning, and we understand that a good program will keep you moving well long term. We spend a lot of time in the gym ourselves. We've done many courses over time. We know how important this area is to keep our clients pain-free and moving well long term. Thanks for taking the time to watch this video. I hope it's given you some really valuable information on why we don't practice only traditional physiotherapy, why we combine the 3 areas. Just in summary, to finish off, so traditional physiotherapy aims to give your pain a label. Give it a name. What structure is sore? Our whole body movement assessments, here's where the cool stuff happens. Here's where we find what to treat to try and fix you long term. And why are we so passionate about adding on a functional strength training program to the end of your physiotherapy? It's what maintains the improvements long term. It's what keeps you moving well, keeps you pain-free, and keeps you healthy long term. We don't believe that there's too much point fixing you if we can't keep you fixed long term. So if this treatment approach sounds like what you're looking for, if you've had other treatment that just hasn't worked or hasn't lasted and you want to give this a shot, reach out to us, and the details are on the next slide. For further information and to contact us, you can jump on our website, www.centralphysiohealth.com. You can send us an email, info@centralphysiohealth.com.au, or you can pick up the phone and give us a call. We're happy to answer any questions. 0756793664. If you want to check us out on some social media, we are on YouTube. Jump on YouTube, Central Physio and Health. You'll find all our exercise videos compiled into playlists there. Choose the topic of your choice. On Instagram, @Central Physio Health. We do our very best to put 1 exercise per day on different injuries, rehabilitation of different areas of the body, how to strengthen various body parts. So if you've got any ideas or you want us to post any ideas on Instagram, please reach out to us there.